Jessica. So first of all, I'm just curious to know your story with breast implant illness. Whatever you want to share, I'm open to it here, and would love to hear how things went for you.
Okay. Yeah. So I guess I'll start kind of at the beginning of why I went the route of getting breast implants. It was 2012. I had just had two babies. My second was about a year and a half. I had breastfed both of the girls, or I have two girls, and um, yeah, I just was in a place where I wasn't very secure about how my breast looked after breastfeeding. And I think I was also just at a kind of a vulnerable place in my life. I had just taken a separation package from a startup that I had been working at. So I was like in transition between jobs, looking at potentially moving out of state and dealing with just my body and my hormones post having these babies and stopping breastfeeding and everything. And so I had implants. I got saline implants, and honestly, like I loved how they looked. I loved pretty much, everything about what I was hoping for from that. I got and I felt, and every time that I was in a bathing suit or a dress, I felt like I could just buy anything and put it on, and it was going to look great. Um, and then so I would say that that's kind of how it was just initially. Like I just felt good about the decision. I just overall felt so much better. And then in about 2 years went by, and so 2014, I started having very irregular periods, and I was like spotting throughout the month, had a lot of just irregular spotting and just bleeding, and started going to doctors to try to find out just what was going on. And they took samples of cells, and I did have, I think at that point in time, maybe like a one thing come back as like an abnormal cell, but like the bleeding it just kept getting worse and worse, and really without any explanation as to why or what was going on. And at this point in time, I was just, following the medical system of like whatever the doctor said, I trusted. I went through many different procedures and appointments, and like they couldn't figure anything out about why I was just bleeding all of the time. And I ended up getting a hysterectomy in 2015. And then, so obviously, that stopped the bleeding. But it didn't solve the underlying issue. And in 2016, I started to have a lot of food intolerances. And I mean, I seemed like I was having reactions to so many things. And I went through what they had called the elimination diet, where you cut like all the major controversial things out of your diet and reintroduced things. And I found I had issues with dairy, I had issues with gluten, I had a lot of issues with nightshades, and some with corn. And I was just like, what is going on? Why have I my whole life been able to eat all of these foods, and now I just could have major reactions at just like the smallest amount of these things? And so I started seeing a functional doctor in 2016, and that helped quite a bit. I mean, I learned things that I didn't have exposure to before that. I learned about candida, I learned about parasites, supplements, all the things. But I was just getting like more and more fatigued all the time. I was exhausted, completely exhausted. And I couldn't gain weight. I was um, pretty underweight. I was at least like 10 pounds underweight. And and like at work, we would always have these annual physicals where we would have to have our blood taken and all of this stuff. And I had always been like 100, because you get, these scores. And I started to get these points taken off because of how low my weight was. And I just could not do anything to gain weight, which is not something that you generally get a lot of sympathy for, right? So that in itself was just kind of isolating because it's not like I didn't feel like I could talk to many people about it. And I was also not getting a lot of suggestions from my regular primary care physician and even the functional doctor. It was more like detox, do detoxes, heavy metal detoxes, parasite cleanses, all these things, which ultimately I don't know how much those things helped or hurted because I wasn't seeing any kind of long-term relief. And then in 2019, I started to develop an autoimmune condition called vitiligo, where I was losing the pigmentation on my skin. And that was probably my biggest wake up call of just what is going on.
Mhm.
And really is what got me to start meditating. I had other things kind of going on in my life with my relationship and in things that I just, really felt called to go inwards. And during this journey through meditation and just really thinking about my life and my choices, I really started to feel like the breast implants were the problem. And I started doing a lot of research into breast implant illness and seeing a lot of correlation between the things that I had experienced and breast implant illness, while also seeing a lot of things that were like, it's not a diagnosable thing. A lot of
Right.
people don't even recognize it as a legitimate
Diagnosis.
concern.
Yeah.
Right. So I was dealing with that. But then must have been maybe like sometime after that, maybe 2020, early 2020. Like I remember seeing Chrissy Teigen post about having her breast implants removed. And like when I saw that, I just felt like I wish that I could do that. And then I was like, well, why can't I do that? Right. I was still in this relationship where I didn't feel very secure in the relationship. I didn't feel like it was really an option for me to go and do that. And, I talked through what I wanted to do with my husband at the time. And it wasn't an easy conversation, right? I think there are some men that are like way more about the boobs than others. And I mean, he made it very well known that like he was a boob guy.
Mhm.
And but that also he supported me if I wanted to go and do this. And so I was like, this is something I really want to do. I really feel like this is not a sustainable path for me to feel so sick while I'm so young. Like
Right.
something has to change. And so I decided to explant. So then all the decisions about how how much do I want to explant and how was what did I want to schedule, where did I want to do it, how much in terms of invasiveness did I want to do. And so I made my decisions around the explant surgery and had that done in like 2020, still 2020, when I had that done. I was honestly like in a very bad place after I had the surgery. It was, I was relieved to have had them out, but I was pretty devastated at just the result of it was like worse than what I had remembered after I had been breastfeeding, right? Like
Mhm.
of looking at my breasts after the explant surgery. it's kind of like I had to deal with all of the things that I hadn't dealt with that had led me to get them in the first place, the
Right.
insecurity that I had, right? Like I had hyped myself up so much that this was something I was doing for me and from a place of empowerment. But I remember just like staring at myself in the mirror after I had taken the bandages off. And it's like realizing that for me, that original decision had really come from a place of lack, of not feeling good enough. And it's like, boom, all of those feelings came
Mm,
back um, tenfold. So I actually moved right into scheduling a fat transfer
okay.
and researching fat transfers, which, like I said, I was in a very underweight place
Yeah,
to
because from my understanding, if you don't have enough fat to transfer, that's not an option for a lot of women, right?
it's right, it's not. And like I found this doctor that really specialized in doing fat transfers on very thin women.
Oh,
And
okay.
um I did move forward with doing that. And that surgery, that's liposuction, right? Like that is no joke to go and recover from. It was for me like so much worse than what I had thought that it
Mm,
was to be. And I had actually signed up for two fat transfers. And I mean, they had to be, fairly spaced apart. And I mean, I still was continuing to meditate during this whole time. And thankfully, I think I made a lot of breakthroughs in like my self-love, giving myself grace for all the decisions that I had made to really change my body in pretty extreme ways. And even after I thought that I had learned the lesson, like I still went and I did it again. And it's so I had been compounding these things that I kind of needed to forgive myself for the changes that I had done and how much I had really not kind of abandoned myself and not loved myself and not made maybe the most healthy decisions for myself in retrospect. And so I canceled the second fat transfer and did not move forward with that and really just focused on getting strong, getting healthy. I For me it wasn't like I got the explant and then I was immediately better. I mean it took a lot of time and I there really wasn't any support from the doctor where I got the explant
that
from.
was a question I had. Yeah, okay. So you
Yeah.
just got the surgery and kind of sent home without any extra.
Yeah, and I think that's why it was just so it really was like very hard to handle. I would say like that first like look at myself in the mirror was quite traumatic,
Right.
um, of just feeling complete despair. And that's ultimately what led me to go and look at, okay, I don't want to get implants in again. I
Hmm.
can't say that like I didn't think about that, like
Right.
of
Of
like
course.
this is
Yeah.
not the right decision for me. I should just have kept them. Um, but I didn't want to do that. And so that's ultimately where I went with the fat transfer route. But it was hard. It was hard. Now, 5 years after the explant, um, honestly, because I didn't have a lot of fat to move, I don't know that the fat transfer made a whole lot of difference
Okay.
for me, other than like where they took the fat from. Now, like, I feel like that's kind of not great, which it's like, I wanted to have the fat cells move to my breasts, but also where they take the fat cells away from, to me, it's like I can tell, right? So I changed other parts of my body inadvertently by trying to change my breasts. So yeah, I think I just got to a place where I was like, I have to heal the inside. I was clinging desperately onto making my outward appearance as beautiful as possible and really trying to compensate for how I didn't feel beautiful on the inside. And yeah, I'm like at this point, I've given myself a lot of grace. I'm happy with where I am at right now, but it's taken time.
Oh, I'm sure. Yeah. Thank you so much for opening up about that because I know that there are a lot of women who have gone through something similar. And it's been interestingly sounds like such a journey inward into exploring your actual inner beauty that you have. So I really appreciate you sharing something that's, so being vulnerable essentially. Um and you really answered a lot of my questions. Your storyline was so great. But I'm guessing so. It sounds like you started out with bleeding. That was your first symptom, and
Mhm.
then they did an extreme surgery. So they totally removed your uterus with a hysterectomy. No possibility of getting pregnant ever again. Remove the ovaries. But you started to have other symptoms like food sensitivities and then this chronic fatigue picture. So you knew something still wasn't quite right. So at what point did you kind of connect the dots with, oh, this might be my breast implants?
Yeah, it really wasn't until probably 2018, 2019. So, I mean, it's like 6 or 7 years after I had had the breast implants. And I had, if I like look back at it, I think there's probably times where I had thought that maybe it could be the breast implants, but I so much didn't want it to be the
Okay.
breast implants
Yeah.
that I was pretty in denial that I would have to have them removed in order to
Right.
be healthy. Like I thought that I could find some kind of alternative therapy or route to health that would allow me to still keep the implants
Yes. Okay. I
in.
see
And
that a
so
lot. Yeah.
I think it took that many years for me to say, okay, like the things keep happening. You're not getting healthier.
Hmm.
Ultimately my health, that is what I want. That is what I need more than I need this image of myself.
Yeah. Yeah. So it sounded like there were some stages that took place. And then there's, of course, the denial stage. And it's like, you look in the mirror and you feel confident, but you also have to consider these things are making you ill. And then at what point, are we at rock bottom where it's like, okay, I have to do something about this for my personal health. And I think a lot of women are faced with that decision that have breast implants, because we can only put it off for so long. And then we're just a lot of times having these debilitating symptoms where it's like, okay, I really have to do something about this now.
Yeah.
Right.
Yeah, and I think like the hysterectomy, having my uterus removed, compounded by the fact now that I'm going to have my implants removed, I just felt like a shell, right? Like I had gone from feeling like this voluptuous woman to I've been carving my body up. I've like, had my uterus removed and now I'm having these implants removed. Like who am I at this point in time? Plus I had these insecurities of my relationship, which did not end up working out well, right? Like so all of my worst fears were realized during the process. And so, I've thought like knowing what I know now, would I have gone through the surgery again? And the beautiful thing is that at this point, I'm so much stronger than I ever thought that I was, right? And it's like, I wish that I maybe didn't have to learn that the way that I had learned it, but it's something that can't be taken away from me at this point. And I think probably even more valuable is that I trust my gut instincts a lot more than I did, right? Like the fact that I kind of just like suppressed my instincts for years because I had made other things a higher priority. And, now I just choose to not live that way. If something is not a full body yes for me, it's a no.
I love that so much. I mean, it's a hard way to learn that, but that was your journey, and now it sounds like you're able to now trust yourself, which is amazing. I think a lot of people don't do that. So, an interesting path getting there for you to certainly.
It
Um,
is.
Thank you again so much for sharing. And is there anything that you would tell other women who are either possibly getting implants or looking into explant surgery? Is there any advice you would have for either group of women?
Yeah, I mean, I think if, women are looking to have implants, one thing that I did think about, obviously I should have dealt with, maybe I shouldn't say obviously, because I don't want to seem like I'm judging. There was a lot of life experiences that I had not dealt with that led me to the place of the insecurities that I had, right? And it would have been much more preferable to me have gone through the pain that I had been avoiding
Hmm.
at that point in time, rather than I feel like I prolonged addressing that pain and then added things on top of it because of the choices that I had made. So, but also I understand like there's women that have gone through having breast cancer, right? And
Hmm.
they are maybe looking at reconstructive
Right.
options. And from a mental health standpoint, I think everybody has to to make that decision, right? Of
Hmm.
what is more important. I wish I had known about fat transfer at the time that I was looking at implants. It wasn't something that I even had evaluated. So, you know, I'd say my first preference would have been that I would have looked at the underlying kind of core wounds that had
Hmm.
made me vulnerable to feeling like I needed to change my outward appearance for my worth.
Hmm.
But had I, done that kind of like knew eyes wide awake what I was walking into, I wish I would have then instead gone with the fat transfer process because at least that was my own
Yeah.
cells, right?
Hmm.
Versus the object being put into the body. And then I think like for the women that are contemplating explant surgery, talking to other women, and
Hmm.
that like you having these conversations is great. And that really helped me talk to other women that had gone through it and what they had struggled with, and also just like accepting that you made the financial investment and it's okay that you're
Hmm.
going to now make the financial investment to get rid of them, right?
Right.
It was a point in time decision that you made, and you could have loved them while you had them or you could have hated them while you had them, and it's still okay to make the choice to just close the chapter on that. But I do think going into an explant, being pretty aware or doing research into detoxes, like after an explant surgery is a great time to have information on how to explant, whether these are just biofilms that have developed around the implants or who knows what, right? Like just having the support system there to for the mental health
Hmm.
aspects of just dealing with the body change, and then having the support there for supporting your physicality as you go through the change is a big key, I think.
Right, yeah, because a lot of women are going into the surgery with that fatigue. They might be
Yeah.
nutrient deficient, hormonally imbalanced. Mindset's a huge one that you touched on, and it's almost like you were forced to face your inner wounds, like you said, and that doesn't go away even after the surgery. We're forced to see ourselves in the mirror when the bandage comes off. So there's a lot of mental health mindset piece there that's very, very important that, like you touched on, the surgeons aren't gonna hold your hand with by any means.
Right.
And then, sometimes these implants leak, so we're dealing with all kinds of chemicals that get into the bloodstream. So a nice detox support for the liver and the tissues, and getting in the sauna and sweating and those sorts of things
Yeah.
are vital. And then also the wound healing and the lymph drainage and all of that. So that's
Yeah.
definitely what we touch on in our program. So I really appreciate you again sharing this, and I think you're going to help inspire a lot of women that aren't really sure what's going on in their body, or they're maybe afraid to get the explant surgery. They're kind of, in that stage where it's like, I spent the money, I made the investment, like you said, and then, I have to go under the knife again. What's life going to be like after? Is my partner going to be attracted to me? Am I going to be attracted to me? So all of those questions will come up, and so it's definitely a journey, it sounds like.
Yeah.
And it sounds like you're on the other side of it now 5 years later, and
I feel
you're having
great.
success. Yeah.
Yeah, and that's one of the things too, right? Because there is so much around breast implant illness and is it real and all of this. So
Right,
it's like,
right,
am I going to have these removed and then I'm still going to continue to feel awful? And
right.
it,
It's a
I
valid
feel
question.
great.
Yeah.
Yeah, so it's like it's hard up front to make the hard decisions when you don't have a guarantee of
Right.
what does the other side look like. So it is
Exactly.
very much a leap of faith of like, I am going to trust my body is going to be able to get through this. I'm going to be able to detox. I'm going to be able to then, get the rest that I need to heal, but there will be healing on the other side.
I love that. Yeah, trusting your inner knowing that, something's not quite right. And it could be the implants. Yeah, there is no guarantee that the symptoms will go away, but it sounds like for a lot of women that we have interviewed, some do still experience maybe some chest pain or heart palpitations, but it's much better than it was usually when the implants are in. So that's super great information. Looks like I'm getting the 10-minute warning for my free Zoom account. But yeah, is there anything else you want to add for today before we?
No, I think thank you for bringing awareness to this topic. I think it's really very needed and very much appreciated. Thank you.